Hi, my name is Jordan Heidi, and I'm here to present to you all our developed pros and cons of common measurement techniques used in the healthcare. So, to get started, we are going to talk about why QI programs are important. Some information is that quality improvement programs are improving the quality of care in a facility. The measurement in healthcare is accomplished by gathering and reviewing data to evaluate the performance of the healthcare delivery system against accepted quality standards. This helps with preventing the overuse, underuse, and misuse of services, provides a guidance in identifying what works and what doesn't, helps hold healthcare providers and plans accountable, identifies disparities in healthcare delivery and outcomes. Lastly, provides consumers with sufficient information to make informed and educated decisions. The quality is directly linked to an organization's service delivery approach or underlying systems of care to achieve a different level of performance and improve quality. An organization's current system needs to change. While each QI program may appear different, a successful program always incorporates the following 4 key principles. QI works as a system and processes, focuses on patients, focus on being part of the team, and focuses on use of the data. The steps just basically are used to plan, implement, improve, study the results, and then we'll act on it. So some pros and cons of what can happen during this QI program. Some pros will be resource management, improved planning, organization, and direction of hospital resources like money and information. Outcome improvement will be fewer adverse events like post-operative complications, hospital mortality, and shorter length of stay. Teamwork will be enhanced interdisciplinary communication and coordination in a bid to deal with ovulation requirements. Patient satisfaction will have higher levels of patient satisfaction in view of quality services delivered. The reliable documentation will be organized, clear, and comprehensive medical and administrative records. Cost minimization, there will be cuts in hospital costs of service delivery. Hospital image, the reputation and prestige of high-rank hospitals in society. Also, educational benefits, more knowledgeable and well-trained staff. The QI program, this just will really give us a good idea of what the good can come out of this. Also, along with good, there is bad. So some cons can be mission deviation, which is deviation of hospitals from their main mission, namely in treating patients. Resource diversion, diverting hospital resources away from strategies aimed directly at addressing the quality and safety issues of services. The workload can be more extra burden of work for hospitals, creating stress and anxiety for their staff. Costly, incurring costs on hospitals if there's a lot that needs to be done. Discouragement, disappointing and discouraging the hospitals from attempts to improve their own functionality following an unsatisfactory score in their prior accreditation program. Incongruence, not fitting well with other quality improvement activities already running in the hospital. Also judgmental nature, over-reliance on value judgment of the surveyors in all allocating scores to standards. So here is just a visual graph for our QI program that we'll be following. Like I said, act, plan, do, and check. So the purpose of the measurement and assessment is to assess the stability of processes or outcomes to determine whether there is an undesirable degree of variation or a failure to perform at an expected level, identifying problems and opportunities to improve the performance of processes, assess the outcome of the care provided, assess whether a new or improved process meets performed expectation. So that's kind of what this little cycle will help us with. Next, how we will chart our progress will be by a run chart. A run chart is the most basic tool to show how a process performs over time. Data points are plotted in temporal order on a line graph. Run charts are most effectively used to assess and achieve process stability by graphically depicting signals of variation. They also help determine whether or not process is stable, consistent, and predictable. Simple statistics such as a mean and range may also be displayed on this. It just basically is helpful understanding variation in process performance, monitors process performance over time to detect signals of change, and we can just see the diagram can identify changes in the performance. So some common measurement techniques used in healthcare. So we'll be using surveys. It'll help our facility because the data used will help us see what areas need improvement on and help us make the changes that are necessary. This gives the patient the opportunity to give their input on our facility and in our different departments. This will show their opinion matters and that we are willing to work on making things better for them. Healthcare should be safe, effective, patient-centered, and timely, efficient, and equitable. Also, cost of healthcare services. They can put an effect on the patients and physicians. This can be because a physician can order a procedure, and if it does not go through insurance, the patient will have to pay out of pocket, and some patients can't afford that. So some of these procedures won't be met. The quality costs for health reports and the rate at which physicians prescribe generic drugs for their patients. Generic prescribing rates have reported for primary care physicians and a number of specialties. Primarily focusing on surveys, existing data in a disciplined and methodical way allows an organization to evaluate its current system. And it just monitors the performance improvement over time. Also, safety, it's an important quality to our patients because we want all our patients to feel safe, have a great experience, to feel protected, none of their personal information will be leaked. No medical mistakes, trying to avoid medical errors in their charts or procedures. Effectiveness of care, some examples can be compliance with the best practice or care guidelines, achieved outcomes. Lastly, focus on patients. An important measure of quality is the extent to which patients' needs and expectations are met. Services are designed to meet the needs and expectations of patients in their community include systems that affect patient access, care provision that is evidence-based, patient safety, support for patient engagement, coordination of care with other parts of the larger healthcare system, cultural competence, including assessing health literacy of patients, patient-centered communication, and linguistically appropriate care. Also, a QI team process is a team process, Under the right circumstances, a team harnesses the knowledge, skills, experience, and perspectives on different individuals within the team to make lasting improvements. The process or system is complex. No one person in the organization knows all the dimensions of an issue. Staff commitment and buy-in are needed. So hopefully these things will help with our QI program, and they will be implemented in our facility. Thank you all for listening.